Thank you for all the suggestions. I mean, I'm going to go get some popcorn. And
oh, great. Great. You know what I'll add to that? Fun is fundamental. Okay? When I write fundamental, I capitalize the F, the U, and the N. It's fundamental to everything in my program. If you're not having fun, you're not doing it the way I would want you to do it. So you just got to have fun, whether you're moving, whether you're having an enema. We used to have enema parties. Have enema with a friend. Why would you want to be at home trying to get your leg up and stick something up your rear end on your own when you can have a friend do it? Come on. Come on.
I do travel a lot, so I love the bars and I have everything individualized.
Thank you.
But my question is, I suffer from migraines. What would be, other than the products here, that I love all of them, what would be something else that you would suggest of?
Great question. You may sit down now. The question was, what do we do about migraines? Migraines, for a lot of people that don't know, are just, you have a very small capillaries in your brain, and sometimes you get spasms in those, and it creates a horrible, horrible headache. And some people say, well, okay, is it genetic? Everything's genetic. You are 50% mom and 50% dad, and then that got all blended together in your DNA, and voila. So everything's genetic, and some people are predisposed to migraines. Some people are predisposed to diverticulosis. Some people are predisposed to heart disease, cancer, diabetes. We're all screwed up, right? That's why I say that. We're not perfect. My patients used to walk in my door and go, I have diverticulitis, or I have diabetes. And I go, yeah, join the club. We're all screwed up. The only perfect is the book of Gray's Anatomy. So if you go to a doctor and you say, what's wrong with me, doc? They're going to find something, right? You're screwed up. You're not perfect, okay? And you start looking deep, you can drive yourself crazy. So, smile, focus on the good, have fun. Fun is fundamental. Migraines. One of my formulas for that is the nerve formula, because my nerve formula not only backs off the pain, but it is antispasmodic. It's a powerful antispasmodic because of the lobelia and other herbs in it. So it stops bodily spasms. Also, what I do is use the brain tonic, because the brain tonic with the ginkgo biloba, and then by adding the cayenne, ginkgo biloba drives more blood and oxygen to your brain quite rapidly. It's famous as doing that. Even the AMA has come out and said that it increases cognitive performance of patients with dementia and Alzheimer's disease. Wow. When the AMA says something, you know it's for real. But anyway, so it drives blood and oxygen to the brain, and we know that senility, depression, panic attacks, anxiety, all of them can be rooted in not getting enough blood flow to the brain. So this is going to increase the blood flow, and at the same time, the nerve tonic will stop the spasm. So what I would like you to do is take 2 or 3 dropperfuls of the nerve formula and 2 or 3 droppers full of the brain tonic. And what I mean by a droppers full is always whatever comes up in the dropper. I don't deal with drops. It's 35 drops, but who wants to count 70, 115, So, 2 or 3 of the nerve, 2 or 3 of the brain. Put it in a little juice because they're both nasty tasting. Brain's hot, nerve's bitter. Put it in a little grape juice or something and knock it back. And do that. How often do you get a migraine?
3 times a week.
3 times a week. And so start doing that. And look for any foods that might cause spasms that you consume. Spasm-causing foods are definitely coffee, chocolate, anything that pumps you up, that speeds up your body, you wouldn't want to do. And just try to, when you feel it coming on, because you'll get the warning, you'll get the notice, try to immediately go into action, chill, relax. Take an extra dose of my tonics right then and there, 3 or 4 dropperfuls of each, and knock it back. If there's a friend nearby, we always need a friend. Do a little neck and shoulder, temples, hard stuff. Don't have anybody do oil, light, get in there, elbows to the, really hard, neck, because you're tough, I can tell. And get in there and do that and work on that one. And try to avoid sugar, alcohol, caffeine, theobromine, even things, new hip things that contain caffeine, because there's nothing wrong with green tea, but it does contain caffeine, and anything like that can create a spasm.